Turning now to your community focus. When it comes to your health, a lot can be tied back to your sleeping habits. And joining us live in studio now to talk about healthy sleep is Dr. Carla Martin with the Rhode Island Department of Health. Thanks for being here.
Thank you.
So time and time again, we're told that it's important to get a good night's sleep. Why is that? What are the benefits?
So sleep is essential for optimal health, just like exercise and healthy eating. While we sleep, our body, there are different processes that happen in our body that helps restore and renew us. We're more alert, we're cognitively work better, we function better at work and at home. And poor sleep is associated with a lot of illnesses. It's associated with higher risks of diabetes, hypertension, cardiovascular disease, stroke, early death, anxiety, depression. So there are many effects of not getting good sleep.
And I wanted to ask you, I'm sure most of us, myself included, sometimes don't get that daily or recommended amount of sleep. Why is that? Why does it seem like more people are struggling to get the sleep that they need?
Well, I think part of it is our culture. America is a culture where we really focus a lot on work and sometimes give up sleep to work, when in fact, not getting enough sleep really impairs our ability to work efficiently and effectively. Also, it increases risks of motor vehicle accidents because of drowsy driving and accidents at work. But the actual recommended hours of sleep is 7 hours minimum for adults. So that's 7 hours in a 24-hour period. Most people don't get that. In fact, 30 to 40% of Americans aren't getting those 7 hours of sleep.
So what can we do to fix that? What is your advice, maybe some simple ways that people can kind of slowly change their sleep habits?
Something simple you can do is have a set bedtime and a set wake-up time. The other thing is screens. A lot of us are addicted to our phones and to our devices, so limiting the amount of time you spend on a screen for that hour before bed. And also putting your phone on Do Not Disturb or shutting off your notifications so you're not being woken up by beeps. There are certain substances that impair sleep, so caffeine is a big one. So not drinking caffeine after 2 p.m. for a bedtime at night. Also limiting tobacco and alcohol, which could impair your sleep. Getting proper exercise will help you get better sleep as well. We also recommend not having a big meal at night right before bed, because that also affects your sleep.
For sure. We're just about out of time here, but I did want to ask you, I know a lot of people maybe turn to taking some sort of like melatonin to get a better night's sleep. Is that good or is it bad? So
it's really recommended you speak with your healthcare professional before you take any medication. Some medications are not appropriate, especially please don't give them to your children without consulting with a physician. But supplements aren't regulated, so you don't really know what you're getting sometimes when you buy a supplement, including melatonin. So it's always best to speak with your healthcare professional.
All right, a lot of helpful tips that we can all use. Dr. Carla Martin, thanks so much for being here.
Thank you.